Birthday Wellness Webinar. Our topic for today is all about asthma. I am Mary Cadine Casabuena, your speaker for today. So what is asthma? It is a condition in which your airways narrow and swell and may produce extra mucus. When you have an asthma, your airways may react to different triggering factors like, for example, smoke, allergens like pollens, or infection. And this will lead to constricted and inflamed airways. So nagkakaroon na tayo ng narrowing of airway. That's why nahihirapan huminga ang isang patient na mayroong asthma. This can make breathing difficult and trigger coughing and a whistling sound or wheezing. This wheezing sound is an indicator that a patient has an asthma attack already. So when you breathe out and shortness of breath. So what are the symptoms of asthma? We have shortness of breath, chest tightness or pain, wheezing when exhaling, then trouble sleeping because of difficulty of breathing, shortness of breath, and then because of nagkakaroon sila ng mga wheezing sound when they exhale. Then coughing, which is accompanied by a wheezing. So what are the causes of asthma? First is genetic. So if sa family nyo meron kayong history ng asthma, so ang tendency kasi nun is na mamana siya. Then we have also allergic reactions to dust or pollens. So it also causes asthma. For the environment naman, because of this cold and sobrang init or humid weather and also dust, so it causes asthma attack. Another one is respiratory tract infection. So we have a common cold, excessive physical activity, kasi once ang isang tao may asthma, hindi siya pwedeng for excessive physical activity kasi once napagod siya, magsa-start yung asthma attack niya. Then exposure to chemicals because of yung amoy ng chemicals, that's why allergy sila doon, it can also cause asthma attack. So what are the asthma signs and symptoms that asthma is flaring up in a certain situation? First, we have the exercise-induced asthma. Nagiging worse ito when the air is cold and dry. So pag nag-exercise ka, pinawisan ka, pag malamig or mainit, so yun, nagsa-start na yung asthma attack mo. Then another one is the allergy-induced asthma. So these are airborne substances such as yung mga pollens and dust. So nag-flare up ang asthma mo. And then occupational asthma. So it will depend kung ano ang klase ng trabaho ng isang patient. For example, sa office, ang nakaka-trigger or nakaka-flare up sa asthma attack is the cold and the hot temperature and also dust. So what are the triggering factor for the asthma? So we have airborne allergens. So we have pollen, dust mites, or sobrang init din, kaka-trigger din siya. Then we have also respiratory infections such as the common cold. Physical activity, pag extreme or too much yung activity ng isang patient, hindi siya pwede. Then cold air, too much coldness, hindi rin siya pwede. Then air pollutants and irritants. For the medications, we have aspirin, NSAIDs or non-steroidal anti-inflammatory drugs such as ibuprofen. So pag nakatake ang patient ng ganitong klase ng medication, for some, since nagkaroon na sila ng allergies, yung mga mata nila nagiging swollen or nagiging red. And then yung iba naman nagkakaroon ng tinatawag natin na skin asthma. Strong emotions and stress also. Sulfites and preservatives, these are all added to food which are processed. And lastly, we have GERD or gastroesophageal reflux disease, which stomach acids back up into the throat. So what are the prevention? So we have to follow doctor's recommendation, which is very much important. We have to get vaccinated. So ano yung mga vaccines na kailangan dito? Aside from the COVID vaccine, so we have to have a flu and pneumonia vaccine. Because of this, it prevents asthma from flaring up. Identify and avoid asthma triggers. So be watchful also kung ano yung nakaka-trigger sa asthma mo. And I mentioned earlier kung ano yung mga triggering factor for the asthma. We also have to monitor your breathing. So be watchful, as I've said, sa mga allergies kasi pag nag-start na yung cough mo, tuloy-tuloy na siya. Then identify and treat attacks early. Malalaman mo if you are starting already an attack because if you are exposed to allergies, for example, or allergens, ang tendency niya is you keep on sneezing or nagsa-start yung allergic rhinitis mo. If allergic rhinitis will start, then to follow na yan ang tinatawag natin na postnasal drip because of excessive mucus secretion. That's why nagkakaroon ng cough. Then after that, nagkakaroon na ng wheezing sound, then asthma attack is already starting. Then take your medication. It means to say wherever you go, bring always your medication kasi unpredictable si asthma. Anytime, pwede siyang mag-atake. So it is very important that you have your medications with you always. So what are the tests for asthma? So we have a spirometry. Sa spirometry, in here, this is a device used to estimate the narrowing of the bronchial tubes. So it is check how much air you can exhale from a deep breath and how fast you can breathe out. Then another one naman is the peak flow. It is a simple device that measures how hard you can breathe out. So if your result is lower than the usual reading, it means to say that your lungs is not working well and your asthma is getting worse. So what are the treatment for asthma? So we have a breathing exercise. In here, patient is taught how to breathe in and breathe out. For this, it increases the lung capacity to cut down severe symptoms of asthma. Then we also have a quick-acting treatments. Usually we have this at home. For those patients who have asthma, this is what we call a nebulizer. So for quick relief, lalagyan na siya ng nebules, then switch it on, then the patient will inhale the smoke para ma-relieve siya sa asthma attack. For those who have long-term asthma naman, so they have a medication to control it. Example of this is the inhaler and other anti-inflammatory medications. So this will help them to reduce the swelling of the mucus productions of their airway para makahinga sila ng maayos. That ends my presentation. Asthma can't be cured, but its symptoms can be controlled. Because asthma often changes over time, it is important that you work with your doctor and track your signs and symptoms and adjust to your treatment as needed. If you have any questions, suggestions, or clarifications, please feel free to reach out the clinic team. For our next week topic, we have pneumonia with Nurse Jerina. Thank you for your time and have a great day. Bye!